discussing news and issues in orthopedics and spine healthcare. This is Spine Talk.
Hi, this is Dr. John Shim, and today I'm here with Jason Mazza, orthopedic assistant, talking about a very important issue, and that's basically the opioid crisis. And we're going to review an article that was basically produced by the American Orthopedic Association titled Leading the Way to Solutions to the Opioid Epidemic. So Jason, can you tell us about this article?
Yeah, so this article published in the Journal of Bone and Joint Surgery from 2017. A little different change of pace for us here today. This is more of a review article as opposed to a study. This article looks at the public health crisis of opioid prescribing in America. The authors present a lot of background information about how the epidemic came to be, along with identifying a lot of the risk factors associated with abuse and diversion of prescription drugs. The article closes with a discussion about a call for orthopedic surgeons and other leaders to develop solutions to address this problem. So for the benefit of everybody, when we talk about opioids, we are talking about medications such as oxycodone, hydrocodone, morphine, codeine, and many others on the list. To no one's surprise, orthopedic surgeons are in the top 4 on being the top prescribers of opioids in the U.S. Some of the interesting facts that came out of this paper, and they looked at other studies, the risk of addiction somewhere between 3 and 45% when used long-term. And the more surprising one, in patients who take opioids beyond 12 weeks, as much as 50% still taking them at 5 years later. Certainly this is a significant public health issue that has been kind of brewing over the last 20 to 25 years. So, Dr. Shim, in looking at our new prescribing laws that went into effect last year in 2018, there's a lot more restriction to accessing pain medications now. So are you in favor of tighter controls, or do you think we should be putting more emphasis on effective treatments for pain control, or perhaps both?
Well, this is a very difficult discussion for patients. If you're used to taking pain medications and all of a sudden the pain medications are not available to the same degree or at ease as you've had before, there's a lot of concern. Mm-hmm. But the truth is we do have to break this cycle. What's happened is, through no fault really of the patients, governmental agencies, societies, pharmaceutical industries got together and decided we can control people's pain better by prescribing these medications, and there shouldn't be a lot of side effects. Mm-hmm. Well, you now know there's been a lot more side effects than originally produced or actually discussed. So for me, I think we're going in the right direction, but really we're trying to reset our population. We're trying to reset medicine to make people a little bit more self-reliant. When we prescribe medications, people think pain goes away. The truth is, there's a lot of coping mechanisms that you have individually as a person that you should also try to execute before you take those pain medicines. We took that ability to cope away by prescribing all these medications. So I think we're actually going in the right direction.
Along those same lines, by limiting what we prescribe, do you foresee kind of unintended consequences in spikes of use and deaths associated with using illicit drugs? Will patients kind of go to that side since they can't get prescription pain medicine as easily now?
Well, actually, that's one of the talking points of why we prescribe these medications, so we can control that better. The reality is, I think we actually created more demand for these medications. If you look at the statistics, U.S. population is somewhere around 6% of the whole world's population, but we consume 80% of the narcotics. So we have an issue here. So to me, I think by unwinding the prescription habits, where we basically help addict people, we're actually going to decrease also the demand for these illicit drugs. I do think there may be a small spike as we do these transitions because people are used to a certain amount of medications. But I think long term, as we go away from the narcotics and people start learning their normal coping skills of how to deal with pain, like the rest of the world does, I think we're going to decrease use and consumption of all these drugs, both prescription and illicit.
And I guess my last question, after looking at this, kind of a lot more broad of a question, but when we look at orthopedics in general, we're facing a aging population. We're having increased rates of obesity and other chronic diseases that put a lot of strain on the joints and spine. We're living longer lifespans, and perhaps there are greater expectations from patients now in terms of what they consider pain relief. Not even considering the social and the economic side of this, as an orthopedic surgeon, do you feel that our current healthcare system is prepared to manage chronic pain kind of now and in the future?
In the short term, no, but we're unwinding a process that we created over 20 years. So if we bring pain management back to the individual's ability to deal with their own pain, the proper expectations of, yes, you're going to have some pain, you're not going to be pain-free, but you're going to be functional. Yes, you can control how much medicine you take, and a lot of these things are biofeedback, they're self-imposed expectations that right now have been set wrong. If we reset them properly, long-term, I do think we're going to have a much better handle on how we deal with people with pain. Short-term, we are going to literally go through some pain as people are used to a different system.
Okay.
So this is Dr. John Shim, and I'm today here with Jason Mazza, orthopedic assistant, talking about the opioid crisis and the maneuvers that are being brought forward to medical societies to help with that crisis. I hope this brings some information to the process and why things are being changed. Thank you for listening.